EDSvideo.com. Thank you.
Hello, my name is Dr. Carlo Oger. I am an emergency medicine physician, and in this video we're going to talk about cardiac catheterization. Your doctor has recommended that you undergo a cardiac catheterization. The most common reason to do this is to evaluate the cause of chest pain. Chest pain might be a symptom of coronary artery disease, and a cardiac catheterization can show whether a plaque is narrowing or blocking your coronary arteries. During angioplasty, a catheter with a balloon in its tip is threaded to the blood coronary artery. Once in place, the balloon can be inflated, pushing the plaque against the artery wall. This creates a wider path for blood to flow to the heart. Sometimes a stent is placed in the artery during the angioplasty procedure. A stent is a small mesh tube that, once deployed, supports the inner artery wall and keeps the lumen open. Most people who have heart attacks have narrow or blocked coronary arteries. Thus, cardiac catheterization might be used as an emergency procedure to treat a heart attack. When used with angioplasty, the procedure allows your doctor to open up the blocked coronary arteries and prevent further heart damage. Cardiac catheterization also can help your doctor figure out the best treatment plan for you if you recently recovered from a heart attack but you're having chest pain still. If you had a heart attack that caused major heart damage. If you had an EKG, an electrocardiogram, stress test, or other tests with results that suggest heart disease. Cardiac catheterization also might be used if your doctor thinks you have a heart defect or if you're about to have heart surgery. The procedure shows the overall shape of your heart and the 4 large spaces or heart chambers inside of it. This inside view of the heart will show certain heart defects and help your doctor plan your heart surgery. Sometimes doctors use cardiac catheterization to see how well the heart valves are working. Valves control the blood flow in your heart. They open and shut to allow blood to flow between your heart chambers and into your arteries. Your doctor can also use cardiac catheterization to measure blood flow and oxygen levels in different parts of your heart. He or she can also check how well a man-made heart valve is working and how well your heart is pumping blood. If your doctor thinks you have a heart infection or tumor, he or she may take samples of the heart muscle through the catheter or a biopsy. With the help of cardiac catheterization, doctors can even do minor heart surgery, such as repair of certain heart defects or electrical conduction problems. So what is exactly a cardiac catheterization? Cardiac catheterization is a medical procedure used to diagnose and treat some heart conditions. In this procedure, a long, thin tube called a catheter is put into a blood vessel in your arm, in your groin or upper thigh, even your neck, and threaded all the way to your heart. Through the catheter, your doctor may put a special type of dye in the catheter. The dye will flow through the bloodstream to your heart. Then your doctor will take X-ray pictures of the heart. The dye will make your coronary arteries visible in these pictures. This test is called a coronary angiography. The dye can show whether a waxy substance called a plaque has built up inside of your coronary arteries. Plaque can narrow or block the arteries and restrict the blood flow to your heart. The buildup of plaque in the coronary artery is called coronary heart disease or coronary artery disease. Doctors also can use ultrasound during cardiac catheterization to see blockages in the coronary arteries. Ultrasound uses sound waves to create detailed pictures of the heart's blood vessels. A catheterization is done by cardiologists, specialists in the heart, and usually do it within the confines of the hospital. You're usually awake during the procedure and it causes little or no pain. However, you may feel some soreness in the blood vessels where the catheter was inserted. Let's talk about the risks of the cardiac catheterization. This procedure is very common. It rarely causes serious problems. However, complications can include the following: bleeding, infection, pain at the catheterization site, also damage to the blood vessels, and rarely the catheter may scrape or poke a hole in the blood vessel that is threaded to the heart. An allergic reaction to the dye that's used during the coronary angiography is also possible. Other less common complications include arrhythmias or irregular heartbeats, because the heart becomes irritated by this hardware inside of it. These irregular heartbeats often go away on their own after the procedure. However, your doctor may recommend treatment if they persist. Kidney damage caused by the IV dye used during the procedure. Also, blood clots can trigger a stroke, heart attacks, and other serious problems, and this is a common complication of any procedure or surgery. A low blood pressure. A buildup of blood or fluid in the sac that surrounds the heart. This fluid can prevent the heart from beating properly. As with any procedure involving the heart, complications sometimes can be fatal. However, this is a rare complication of cardiac catheterization. The risk of cardiac catheterization is higher in people who are older and in those who have certain diseases or conditions such as chronic kidney disease or diabetes. What to expect after the procedure is done? Well, after your cardiac catheterization, you will be moved to a special area of the hospital that can manage serious cardiac patients like the cardiac rehab unit or cardiac unit. You will rest there for several hours or even overnight. During that time, you'll have to limit your movement to avoid bleeding from the site where the catheter was inserted. While you recover in this area, nurses will check your heart and blood pressure regularly. They will also check for bleeding from the catheter insertion site. A small bruise may form at the catheter insertion site, and the area may feel sore or tender for about 1 week. Let your doctor know if you have problems such as a constant or large amount of bleeding at the insertion site that cannot be stopped with a small bandage. If the pain is unusual, if there's swelling, redness, warmth, fever, or any other signs of infection at or near the site of infection. Talk to your doctor about whether you should avoid certain activities such as heavy lifting for a short time after the procedure. This is the end of the educational video about cardiac catheterization. I hope it was useful to you and that you'll learn a lot. For other videos like this one, go to edxitvideo.com. Thank you.